to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Good morning and welcome to Bench to Bedside. I'm Dr. Jennifer Klemp, a co-program leader for the Cancer Prevention and Survivorship Program at the University of Kansas Cancer Center. And today I'm sitting in for Dr. Roy Jensen. And today we have some fabulous guests. Dr. Moira Mulhern is a community psychologist and the co-founder of Turning Point, and she also serves as their executive director. And we also have Courtney Gustafson, who is a participant of some Turning Point programs and is here to sort of share some of her experiences with us this morning. Turning Point is part of the University of Kansas Cancer Center and part of the University of Kansas Health System. It's a vital community resource, and it really helps people with chronic illness and serious medical conditions cope and deal both with themselves as well as their family and friends. And they can learn skills that really help them to reduce symptoms and increase their ability for coping. They use really innovative educational strategies and services and some unique tools that we'll hear about today to help individuals and their families take charge of their life and their illness and hopefully live their life to the fullest. So Dr. Mulhern, can you tell us a little bit about how you helped co-found Turning Point and what's it all about?
Yeah, well, we started Turning Point to fill gaps in support services here in Kansas City. What we found were there were a lot of support groups and a lot of people could get therapy anywhere, but what didn't exist in Kansas City were programs, the time-limited skills-based programs that teach people how to manage the stress of an illness, teach their loved ones how to manage the stress of an illness, and teach them how to bounce back in the face of whatever comes their way.
Great. And I think having lived in the community, we've seen a lot of change from some of the programs that you've been able to offer. Oh, yes. And what you just mentioned, it's more than just a support group. Mm-hmm. And there's some specific skills that you teach and train as part of your programs. Can you give a little bit of background on some of your key programs or some of those key skills that would be cores to your programs?
Okay, yeah. The underlying philosophy of all of our programs is resilience, and it's a particular resilience model that we use that has 10 facets that we know separate resilient people from non-resilient people. And so all of the programs we offer feed into that resilience model. So we have exercise programs, we have nutrition programs, we have lots of programs on how to cope with the emotional distress, how to lower anxiety, depression, and distress related to medical conditions, not just for the person who's sick, but for their entire support system.
That's great. Yeah. And I recall recently seeing some of the research that you've been able to, publish. So how have these programs really impacted some metrics, and what does that look like?
Yes, so when we joined the hospital, we were assigned a researcher, and we have been collecting data ever since we joined in 2012, and we find that our programs reduce anxiety, depression, and distress at a highly significant level.
That's amazing. Because as we know, it's really hard to make change in a short or a longer period of time. Mm-hmm. So the fact that you're using these techniques and these skills, mm-hmm. it sounds like it's really having a good return for the patient and their families.
It is. And these skills that they're learning, they're coming to us because they want to learn some skills to cope better with the illness process, but it transfers to every aspect of their life. So
absolutely.
Very often we have people telling us they feel better now than they did before they got sick. So
that's great. Yeah, I think we could all learn a little bit from some of those facets of resilience.
Yeah, everybody needs to know them, whether they're sick or not. Yeah,
for sure. So if you're just joining us, we're talking today about resources that are offered to patients and families at Turning Point, which is an amazing community resource here in the greater Kansas City area. We also have Alicia Miller, who's taking questions from you all out in Facebook land. So if you have a question, please feel free to share that. And we also work under the hashtag BenchToBedside. So Dr. Mulhern, one of the other things that I think is really unique about Turning Point is that you're not just for cancer and you're not just for adults. So can you talk a little bit more about some of the targets that you work with population-wise, and then some programs that are for children as well?
Right. So We work with anyone who has a serious or chronic physical illness. So it could be someone with cancer, it could be someone with heart disease, diabetes, autoimmune diseases, any chronic physical condition, any serious or chronic physical condition we work with. And we also work with children, primarily the children who have a sick parent or sick sibling or sick grandparent, a sick family member. And we have programs for kids from age up through the teenage years.
Great. And it's my understanding as well, you are part of the University of Kansas Health System, but as a community resource, you are sort of like Switzerland. You work with patients regardless of where they're cared for and where their parents or the loved ones are cared for. Is that correct?
That's correct. We see patients from all over the metro. Any hospital, regardless of what hospital, where their physician is, they can come to Turning Point, and they do.
And I think that is also unique because I know that sometimes there'll be a support group, and patients sometimes feel awkward going to a support group that's at a hospital or a physician's office that isn't where they get their treatment. So your location is where? Tell us about where you're located.
We're at 89th and State Line.
Okay.
We have a beautiful space with meeting rooms and a living room and a kitchen. It's a very comfortable home-like setting.
That's great. Thank you. And Courtney, as a person who's been able to benefit from some of the Turning Point programs, can you tell us a little bit about your experience and then the experience of maybe your children as well?
Sure. So, we take advantage of pretty much everything that will fit into our schedule because they have such a variety, and everything we've taken there, all the classes we've taken have all been exceedingly helpful. So, I get my program in the mail about the next 2 months classes, and I start circling and I call them up and schedule my spot because it really is, it is a very warm environment physically, but also just even personally, all the people that work there are very warm, very welcoming. It's a space where when you already have a lot of other challenges happening, you feel very comfortable and you don't sort of have to have that layer of, oh, well, I'm bald today and people might look at me weird. You feel very comfortable because there's other people there either going through the same thing you're going through or who, who have health issues of their own. And so.
And how did you first make it to Turning Point? Was it a friend or a physician? Or?
So when my mom was going through her cancer treatment, we used to see the brochures in, the doctor's offices and whatnot. And I'd always look at them and say, Mom, we should go to some of these. These are like really good programs. And we never made it. And then fast forward to my cancer diagnosis and then my treatment, and of course the pamphlets were still there. And so I said, this time I'm gonna go. And I ended up eventually getting there because of my children. As a parent concerned about how this would impact them, I thought looks like a great free resource for my children. But of course I ended up staying for me, so I take advantage of as many of the classes as I can too. So.
That's great.
Yeah.
And some of the things that your kids have been able to kind of experience, what are the things like if you could pinpoint maybe a specific issue or something that they were struggling with and what helped them through the Turning Point program?
So, they offer a wide variety, anything from music programs to sort of arts and crafts to, sort of play therapy-based things. One of the things that's been really nice for us is that it offers us a sort of structured environment to kind of come together as a family and experience people there to help us and not just distract us, but entertain us and allow us to sort of be ourselves together in a way that's separate from the illness.
And you can process that experience probably.
Yeah. And it's a good thing to do together besides just dragging the kids to doctor's appointments and those kinds of things, so they can sort of be a part of the illness without the illness being the main focus. A nice bonding opportunity for us.
Very good.
Yeah.
So I think we have a question that came in. Do you want to?
I do have a question. Does it cost money to participate in programs at Turning Point?
That's great.
Can I take that, actually?
Absolutely,
That's
Courtney.
one of the best things is that it's all free. And that is such a big relief when you already have things like medical bills and, activities that offer just so much at no cost to you at all. That really makes it accessible. And so, sorry, you can follow up on that. But it
Dr.
just
Mulhern,
has been really important to
And how do you make that happen? So
Well, we make that happen through philanthropy, yes. Turning Point is donation-based. Programs are all free of charge, and we rely on donations from our generous donors.
That's great.
To keep
and
the
do you have any
programs
special
free.
events that help bring people together, that help you raise money as well?
Well, we have one now.
Great.
It's in the spring, and it's a card party. It's a morning of cards. It's called
That
Bridge
sounds
of Hope. It's
that sounds
really
awesome.
nice. Yeah.
Great. Well, good.
Yeah,
These shared resources, I think that the nice part about them being free is that it does bring the community together to help support these vital resources. So that's great that you've been around. What's your year now? How many
We
years?
started in 2001.
2001.
Yeah.
That shows you're resilient. That's great.
Yes, we are.
And I
We
think-
live it.
Yes,
Yeah,
we live
do.
what we preach. There's another question that's come in.
Yes, there's another question. Are there programs that encourage cancer survivors to do strength training or other types of exercise?
So, Courtney, do you want to answer
I
that one?
participated in one, yes. One of the programs, I think it's called Moving for Life, is that correct, by Susan Rieger? It's actually tailored specifically for people going through cancer treatment. They're very mindful of things like the possibility of lymphedema and sort of stretching and things like that. So low impact, but gets you moving and really helps. And there's also another one I think that's about functional sort of exercise.
Yeah, functional exercise. We have
Right,
that
yeah.
program too.
And you brought up a really great point, the need for us as medical providers to send patients to places where we know that the people that you have on your staff are trained with patients who maybe do have special needs, where they've had their lymph nodes removed, or maybe it's a neurological condition or a heart condition. So tell us about kind of the staff that you have, and it seems like you have a pretty multidisciplinary staff.
We do. So we have 8 staff members, but about 100 contract facilitators that have professions elsewhere and maybe private practice. And regarding the exercise programs, the people who provide the exercise programs have to be trained to work with populations who have limitations.
So
like the
you
ones we
can
do.
choose from
So
the best from the best.
We do,
That's
yeah.
great. All right, I think there's another question that's come in.
Yes. Are there any Spanish programs?
Unfortunately not currently. There has not been a big demand for Spanish-speaking programs, but we would love to do them someday. And actually we did a while back. We had a program on diabetes, Spanish, that was facilitated by a Spanish-speaking facilitator. But
And you pointed out
we
that
could do
your
it,
your
yeah.
main facility is in Leawood, but you're delivering programs across our what we call the catchment area, or
Right.
really our region. How are you doing that?
So all we need most of the time is a conference room to do a program, and so we are mobile. We can take Turning Point to any other part of the city, and we do. We go to North Kansas City, we go further south, we go to Lee Summit, and really any place that somebody requests a program
Great.
within this area.
And Turning Point to Go, as you said, so
Turning Point to Go,
it could be in
yeah.
person. And do you ever also do things sometimes by video? Is that something that you've offered in the past?
Well, we've done programs across the state of Kansas through ITV, and we now have 7 modules on our website that people can log into and experience a brief version of one of the classes. And
That's
this would be
great.
for people who can't get out of the house or who want a refresher or
And how do they get to those modules? Because some people like in person, some people like having something to go back to. So how does one find your modules?
So they find the modules by going to our website, turningpointkc.org, and it's there's a resilience toolbox underneath the program icon, and it takes you right to them.
So you just click on that box and
Click
there
on the
you
box,
go.
and there you go. You have your menu.
That's great.
Yeah.
And how long does a module potentially take someone to take?
Well, there's no real start or finish. It's not like you start and it takes 15 minutes.
Okay.
You have a lot of options of things that you can do within that module. So you can read things, you can listen to tutorials, which are just a few minutes. You can download some of the relaxation exercises, some PDFs.
So
some
really
other
it's sort of
things.
self-directed.
It's self-directed, yeah.
Build my own journey.
Right, and you can spend as much or as little time there as you need to and get something out of it.
That's exceptional. And did you just recently launch these?
We did, yeah.
Great. Well,
just at the
congratulations.
beginning of this
That's
year.
great.
Thanks.
Very good. And you also do a lot of training, right? So you kind of train the trainer. So across the community, I think you've been able to really instill some of those facets, especially of resilience and other of your programs across the community. Is that correct? Is that something someone could reach out to you and learn more about as well?
Yes, they could. What we do a lot of resilience training. We have actually a number of different training programs on communication, the basis of leadership. So
that's great.
Yeah, we do train the trainer. We'll go out. We have a lot of programs that can help with compassion fatigue and burnout for healthcare professionals, and we've been doing those out in the community as well with not-for-profits who have a, who have a high risk for compassion fatigue and burnout too.
So really your programs are targeted towards patients, families, children, healthcare professionals, and
corporations.
Really across
we go
the
into
board.
companies and
That's
provide
great.
programs too.
That's awesome. Well, thank you for sharing.
Thanks
this has
for
been
having us.
really insightful to
Yeah.
learn more about Turning Point. And Courtney, thank you so much for sharing your personal experience, and we hope that you continue to glean benefits from Turning Point.
I'm glad to be here. I can't say enough good things about Turning Point. I keep asking when they're going to kick me out, but I'll keep
We'll
coming
never
as long
kick
as
her
they'll
out.
keep
Yeah.
letting me. So
We'll
Good.
keep letting her. Yeah.
Well, thank you, Dr. Mulhern, and thank you, Courtney. And hopefully you all can join us next Wednesday, where you're going to learn about advances in precision medicine right here from Bench to Bedside.